Types of pathogen. A pathogen is a microorganism that causes disease. Pathogens can be classified into 5 major types. 1. Bacteria. Bacteria are single-celled organisms that can be found in soil, water, and air. Some common bacteria that cause infections include Staphylococcus aureus, Escherichia coli, and Mycobacterium tuberculosis. 2. Viruses. Viruses are even smaller than bacteria and can only reproduce inside a living host cell. Some common viruses that cause infections include HIV, hepatitis, herpes zoster, and herpes simplex. 3. Fungi. Fungi are multicellular organisms that can be found in soil, air, and on plants. Some common fungi that cause infections include Candida albicans and Aspergillus. 4. Prions. Prions are misfolded proteins that can cause disease. Some common diseases caused by prions include new variant Creutzfeldt-Jakob disease and bovine spongiform encephalopathy. 5. Parasites. Parasites are organisms that live in or on another organism and get their nutrients from that organism. Some common parasites that cause infections include malaria, toxoplasmosis, flatworms, roundworms, and flukes. Virulence. Virulence is the ability of a pathogen to invade and injure a host. Some pathogens, such as herpes zoster, are highly virulent, while others, such as the common cold virus, are less virulent. Herpes zoster is a common viral infection that erupts years after exposure to chickenpox. The virus invades a specific nerve tract, causing a painful rash and blisters. Nurses need to be aware of the different types of pathogens and their virulence in order to provide effective infection control. Immune defenses. The immune system is the body's defense against disease. It is made up of a complex network of organs, cells, and proteins that work together to protect the body from infection. The immune system can be divided into 2 main parts, the innate immune system and the adaptive immune system. Innate immune system. The innate immune system is the body's first line of defense against infection. It is a non-specific system, meaning that it responds to all pathogens, regardless of their type. The innate immune system includes the following. 1. Physical barriers. The skin and mucous membranes are physical barriers that prevent pathogens from entering the body. 2. Chemical barriers. The body produces a variety of chemicals, such as stomach acid and tears, that can kill or inactivate pathogens. 3. Cells. The innate immune system includes a variety of cells, such as phagocytes and natural killer cells, that can engulf and destroy pathogens. 4. Inflammatory response. The innate immune system also triggers an inflammatory response, which is a process that helps to localize and fight infection. Adaptive immune system. The adaptive immune system is a more specific immune response that develops over time. It is responsible for developing antibodies, which are proteins that can bind to and neutralize specific pathogens. The adaptive immune system includes 2 main types of cells, B lymphocytes and T lymphocytes. B lymphocytes are responsible for producing antibodies. When a B lymphocyte encounters a new pathogen, it produces antibodies that are specific to that pathogen. These antibodies bind to the pathogen and neutralize it. T lymphocytes. T lymphocytes are responsible for killing infected cells and regulating the immune response. The adaptive immune system takes longer to respond to infection than the innate immune system, but it provides more lasting immunity. Types of immunity. There are 2 main types of immunity, active and passive immunity. Active immunity. Active immunity is acquired when the body produces its own antibodies in response to an infection. This can be done through natural infection or vaccination. Passive immunity. Passive immunity is acquired when antibodies are transferred from one person to another. This can happen through the placenta from mother to fetus or through breast milk. The immune system is a complex and sophisticated system that protects the body from disease. It is important to understand how the immune system works in order to maintain good health. The chain of infection. The chain of infection is a model that describes how infections spread. It is made up of 6 links. 1. Causative agent, the microorganism that causes the infection. This can be a bacteria, virus, fungus, prion, or parasite. 2. Reservoir, the source of the microorganism. This can be a human, animal, food, organic matter on inanimate surfaces, water, soil, or insects. 3. Portal of exit, the way the microorganism leaves the reservoir. This can be through the respiratory tract, gastrointestinal tract, genitourinary tract, skin or mucous membranes, blood or body fluids, or transplacental, mother to fetus. 4. Mode of transmission, the way the microorganism is transmitted from the reservoir to a new host. This can be through direct contact, indirect contact, droplet transmission, or airborne transmission. 5. Portal of entry, the way the microorganism enters the new host. This is usually through the respiratory tract, gastrointestinal tract, skin or mucous membranes, or blood or body fluids. 6. Susceptible host, a person who is at risk of developing an infection. This can be due to age, underlying health conditions, or immunosuppression. In order for an infection to occur, all 6 links of the chain of infection must be present and intact. Mode of transmission. Mode of transmission is the way in which a pathogen is transmitted from one host to another. There are 4 main modes of transmission. 1. Contact transmission. Contact transmission is the most common mode of transmission. It can be further divided into 2 types. Direct contact. Direct contact transmission occurs when a pathogen is transmitted directly from one person to another through physical contact. For example, direct contact transmission can occur when 2 people shake hands or when a person kisses an infected person. Indirect contact. Indirect contact transmission occurs when a pathogen is transmitted from one person to another through contact with a contaminated object. For example, indirect contact transmission can occur when a person touches a doorknob that has been contaminated with a pathogen and then touches their eyes, nose, or mouth. Examples of contact-transmitted pathogens: bacteria, Staphylococcus aureus, Escherichia coli, Neisseria gonorrhoeae, and Chlamydia trachomatis. Viruses: herpes simplex virus, Varicella zoster virus, and human papilloma virus. 2. Droplet transmission. Droplet transmission occurs when a pathogen is transmitted through respiratory droplets that are produced when an infected person coughs or sneezes. These droplets can land in the mouth or nose of a nearby person or possibly be inhaled into the lungs. Examples of droplet-transmitted pathogens: bacteria, Streptococcus pneumonia and Mycobacterium tuberculosis; viruses, influenza virus, and respiratory syncytial virus. 3. Airborne transmission. Airborne transmission occurs when a pathogen is transmitted through tiny particles that remain suspended in the air for long periods of time and can be inhaled into the lungs. Airborne transmission can occur even if the infected person is not coughing or sneezing. Examples of airborne transmitted pathogens: bacteria, Mycobacterium tuberculosis; viruses, Varicella zoster virus, measles virus, rubella virus. 4. Vector-borne transmission. Vector-borne transmission occurs when a pathogen is transmitted from one host to another through an insect or other animal that acts as a vector. For example, malaria is transmitted to humans through the bite of an infected mosquito, and Lyme disease is transmitted to humans through the bite of an infected tick. Examples of vector-borne pathogens: bacteria, Borrelia burgdorferi, Lyme disease. Viruses, West Nile virus, dengue virus, and Zika virus. Parasites, Plasmodium species, which causes malaria. Portal of entry. The portal of entry is the way in which a pathogen enters the body of a new host. The portal of entry is often the same as the portal of exit from the original host. For example, respiratory droplets that contain a virus can enter the body of a new host through their respiratory tract. Susceptible host. A susceptible host is a person who is at risk of developing an infection. Susceptibility to infection can be influenced by a number of factors, including age, underlying health conditions, and immune status. For example, young children and older adults are more susceptible to infection than healthy adults. People with underlying health conditions, such as HIV/AIDS or diabetes, are also more susceptible to infection. Understanding the different modes of transmission can help nurses to develop and implement effective infection control practices. By following infection control practices, nurses can help to prevent the spread of disease and protect the health of their patients. Stages of an infection. An infection is the process by which a pathogen or disease-causing microorganism enters the body, overcomes the body's defenses, and multiplies. Infections can range from mild to severe and can even be fatal. The stages of an infection are as follows. 1. Incubation period. The incubation period is the time between the pathogen entering the body and the appearance of the first symptoms. This period can vary depending on the type of pathogen and the person's immune system. For example, the incubation period for the common cold is usually 2 to 3 days, while the incubation period for HIV can be several weeks or months. 2. Prodromal stage. The prodromal stage is the time between the onset of general symptoms, such as fever, fatigue, and muscle aches, and the appearance of more specific symptoms related to the infection. During this stage, the pathogen is multiplying in the body. 3. Illness stage. The illness stage is the time when the person experiences the full range of symptoms associated with the infection. The severity of the illness and the duration of the illness will vary depending on the type of infection and the person's immune system. 4. Convalescence. The convalescence stage is the time after the acute symptoms of the infection have disappeared. During this stage, the body is repairing itself and building immunity to the pathogen. Image of the stages of an infection. It is important to note that not all infections go through all 4 stages. For example, some mild infections may only cause symptoms during the prodromal stage. Other infections may be more severe and cause symptoms throughout all 4 stages. Nurses can play an important role in helping patients to recover from infection. By providing supportive care, educating patients about their infection, and monitoring for complications, nurses can help patients to get better faster. Healthcare-associated infections, HAI. Healthcare-associated infections are infections that a patient acquires while receiving care in a healthcare setting. They can be caused by a variety of microorganisms, including bacteria, viruses, and fungi. HAI can occur in any type of healthcare setting, but they are most common in hospitals, especially in the intensive care unit. HAI can be caused by a variety of factors, including 1. Contact with contaminated surfaces. HAI can be transmitted through contact with contaminated surfaces, such as medical equipment, bed linens, and healthcare workers' hands. 2. Invasive procedures. HAI can also be caused by invasive procedures, such as surgery and catheterization. 3. Weak immune system. Patients with a weakened immune system are more susceptible to HAI. HAIs can range from mild to severe, and some can even be fatal. The most common symptoms of HAI include fever, chills, pain, redness and swelling at the infection site, pus or drainage from the infection site. Nurses can play an important role in preventing HAI by following infection control practices, such as hand hygiene, cleaning and disinfecting surfaces, and using sterile equipment and supplies. Here are some specific ways to prevent HAI. Wash your hands frequently with soap and water or an alcohol-based hand sanitizer. Clean and disinfect surfaces regularly. Use sterile equipment and supplies for all invasive procedures. Educate patients about infection control practices. HAI can be treated with antibiotics, antifungals, or antiviral medications, depending on the type of infection. Risk factors for infection. A nurse should assess each patient for the risks of infection specific to the patient, the disease or injury, and the environment. The most common risks include inadequate hand hygiene, patient and caregivers. Hand hygiene is one of the most important ways to prevent the spread of infection. Nurses and other healthcare workers should wash their hands frequently with soap and water, or use an alcohol-based hand sanitizer. Patients should also wash their hands frequently, especially before eating and after using the bathroom. Individuals who have compromised health or defenses against infection, which include 1. Those who are immunocompromised. People who are immunocompromised are more susceptible to infection because their immune systems are weakened. This can be due to a variety of factors such as HIV/AIDS, cancer treatment, or organ transplantation. 2. Those who have had surgery. Surgery creates a break in the skin, which can allow bacteria to enter the body. Patients who have had surgery are also at risk for infection because they may be receiving antibiotics, which can kill off the good bacteria that help to protect the body from infection. 3. Those with indwelling devices. Indwelling devices such as catheters and feeding tubes can provide a pathway for bacteria to enter the body. Patients with indwelling devices need to be carefully monitored for signs of infection. 4. A break in the skin, the body's best protection against infection. A break in the skin, such as a cut, wound, or burn, can allow bacteria to enter the body. It is important to clean and disinfect any breaks in the skin right away. 5. Those with poor oxygenation. People with poor oxygenation are more susceptible to infection because their tissues are not getting enough oxygen. This can be due to a variety of factors, such as heart disease, lung disease, or diabetes. 6. Those with impaired circulation. People with impaired circulation are more susceptible to infection because their blood is not flowing properly to all parts of the body. This can be due to a variety of factors, such as diabetes, peripheral artery disease, or blood clots. 7. Those who have chronic or acute disease, such as diabetes mellitus, adrenal insufficiency, renal failure, hepatic failure, or chronic lung disease. People with chronic or acute diseases may have a weakened immune system, which makes them more susceptible to infection. 8. Caregivers using medical or surgical asepsis that does not follow the established standards. Medical and surgical asepsis are practices that are used to prevent the spread of infection. Caregivers should follow established standards for medical and surgical asepsis when providing care to patients. 9. Clients who have poor personal hygiene or poor nutrition smoke or consume excessive amounts of alcohol, and those experiencing stress. Good personal hygiene, good nutrition, and stress management can help to keep the immune system healthy and reduce the risk of infection. Smoking and excessive alcohol consumption can weaken the immune system and make people more susceptible to infection. 10. Clients who live in a very crowded environment. Crowded environments can increase the risk of exposure to pathogens. People who live in crowded environments should take precautions to prevent infection, such as washing their hands frequently and avoiding close contact with people who are sick. Older adult clients. Older adults have a number of risk factors for infection, including slowed response to antibiotic therapy, slowed immune response, loss of subcutaneous tissue and thinning of the skin, decreased vascularity and slowed wound healing, decreased cough and gag reflexes, chronic illnesses, decreased gastric acid production, decreased mobility, bowel and bladder incontinence, dementia. Greater incidence of invasive devices such as a urinary catheter or feeding tube, individuals who make poor lifestyle choices that put them at risk, which include 1. Clients who use IV drugs and share needles. Sharing needles is a major risk factor for HIV infection and other bloodborne diseases. 2. Clients who engage in unprotected sex. Unprotected sex can transmit sexually transmitted infections, STIs, such as HIV, chlamydia, and gonorrhea. 3. Clients who have recently been exposed to poor sanitation. Poor sanitation can lead to the spread of pathogens that cause diseases such as cholera and diarrhea. Mosquito-borne or parasitic diseases. Mosquito-borne diseases such as malaria and yellow fever can be transmitted through mosquito bites. Parasitic diseases such as hookworm and giardiasis can be transmitted through contact with contaminated soil or water. Diseases endemic to the area visited but not in the client's home country. Some diseases, such as tuberculosis and yellow fever. Expected findings of a generalized or systemic infection. Fever is the most common finding in a generalized or systemic infection. Fever is a rise in body temperature above normal. Normal body temperature is 98.6 degrees Fahrenheit. A fever is considered to be present when body temperature is 100.4 degrees Fahrenheit or higher. Chills are another common finding in a generalized or systemic infection. Chills are a sensation of coldness and trembling. They occur when the body is trying to raise its temperature. Diaphoresis, or sweating, is another common finding in a generalized or systemic infection. Diaphoresis occurs when the body is trying to cool down after a fever has broken. Increased pulse rate is also a common finding in a generalized or systemic infection. The pulse rate is the number of times the heart beats per minute. A normal pulse rate for adults is 60-100 beats per minute. An increased pulse rate, or tachycardia, is a sign that the body is trying to pump more blood to the tissues in order to fight the infection. Increased respiratory rate, or tachypnea, is also a common finding in a generalized or systemic infection. The respiratory rate is the number of breaths a person takes per minute. A normal respiratory rate for adults is 12-20 breaths per minute. An increased respiratory rate is a sign that the body is trying to get more oxygen into the blood to fight the infection. Other findings that may be present in a generalized or systemic infection include malaise is a feeling of general weakness or discomfort. Fatigue is a feeling of tiredness or lack of energy. Anorexia is a loss of appetite. Nausea is a feeling of queasiness or stomach upset. Vomiting is the forceful ejection of stomach contents through the mouth. Abdominal cramping is a pain in the abdomen that is caused by muscle spasms. Diarrhea is frequent, loose or watery stools. Enlarged lymph nodes are lymph nodes that are swollen and tender. Laboratory tests. Let's begin with laboratory tests, which play a crucial role in identifying and understanding infections. Several indicators can provide valuable information about a patient's health status. We'll start with leukocytosis. 1. Leukocytosis. Leukocytosis, defined as a white blood cell count greater than 10,000 per microliter, is a common marker of infection. Elevated levels of white blood cells, or WBCs, suggest an active immune response. Additionally, a left shift in the differential count, indicating an increase in neutrophils, is often observed during infections. 2. Erythrocyte sedimentation rate, ESR. The erythrocyte sedimentation rate is another valuable test. An ESR over 20 millimeters per hour suggests an active inflammatory process or infection. Monitoring ESR levels helps healthcare professionals assess the severity and progression of the infection. 3. Microorganisms on culture. Performing cultures of specific fluids or areas is a fundamental step in identifying the causative agents of infections. The presence of microorganisms in cultures provides essential information for targeted treatment. Diagnostic procedures. Now, let's shift our focus to diagnostic procedures, which involve more advanced techniques to pinpoint the source and nature of infections. 1. Gallium scan. The gallium scan is a nuclear imaging technique that employs a radioactive substance to identify hotspots of white blood cells. This procedure, known for its sensitivity, helps locate areas of active infection. 2. Radioactive gallium citrate. Injected intravenously, radioactive gallium citrate accumulates in areas of inflammation. This accumulation aids in visualizing the extent and location of infection, providing valuable insights for targeted interventions. 3. Imaging techniques and biopsies. In addition to nuclear scans, other imaging techniques such as X-rays, CT scans, and magnetic resonance imaging, MRI, play a crucial role in identifying infections, abscesses, and lesions. Biopsies, involving the removal of a small tissue sample, are also employed to analyze the nature of infections at a microscopic level. Laboratory tests and diagnostic procedures are invaluable tools in the identification and management of infectious diseases. The combination of these methods allows healthcare professionals to make informed decisions for optimal patient care. Infection prevention. 1. Hand hygiene. Before and after providing care, it is imperative to wash hands thoroughly. This simple yet powerful practice significantly reduces the risk of transmitting microorganisms. 2. Immunizations. Target groups, including children, older adults, those with chronic diseases, and immunocompromised individuals, should be well informed. Provide guidance on where to obtain these vaccinations for themselves and their families. 3. Oral hygiene. Educate the client about good oral hygiene practices, and don't forget to request a return demonstration. Maintaining oral health reduces the protein in the oral cavity, limiting the growth of microorganisms that could potentially enter the body through breaks in the oral mucosa. 4. Adequate fluid intake. Encourage clients to consume an adequate amount of fluids. This not only prevents urinary stasis, but also flushes the urinary tract, reducing the growth of microorganisms. Adequate hydration is also essential for maintaining intact skin, preventing the entry of microorganisms into the body. 5. Pulmonary hygiene for immobile clients. For immobile clients, pulmonary hygiene is crucial. Turning, coughing, deep breathing, and incentive spirometry should be performed every 2 hours or as prescribed. This practice decreases the growth of microorganisms, preventing pneumonia by promoting the clearance of pulmonary excretions and expanding the lungs. 6. Aseptic technique and personal protective equipment. Employing gloves, masks, gowns, and goggles in the provision of care is essential. This prevents unnecessary exposure to microorganisms, ensuring the safety of both the healthcare provider, and the client. 7. Respiratory hygiene, cough etiquette. This applies to anyone entering a healthcare setting with signs or symptoms of illness. Components include covering the mouth and nose when coughing or sneezing, using facial tissues, wearing a surgical mask, turning the head when coughing. Isolation guidelines. Isolation guidelines encompass a set of measures, including hand hygiene and barrier precautions designed to minimize the spread of infectious organisms. Universal application. These precautions are universally applicable, extending to every client regardless of their diagnosis. Implementation is crucial whenever there's an expectation of contact with potentially infectious materials. Personal protective equipment, PPE. It is imperative to change personal protective equipment after each client interaction. Additionally, if in contact with substantial amounts of blood and body fluids, PPE should be changed between procedures with the same client. Clients in isolation face an increased risk of depression and loneliness. It is essential to collaborate with the client and their family, helping them comprehend the necessity for isolation while providing sensory stimulation. Isolation can be emotionally challenging for clients. Healthcare professionals play a vital role in supporting emotional well-being by addressing feelings of loneliness and implementing strategies to alleviate depression. Effective communication is key when dealing with isolated clients. Ensure clear and empathetic communication to keep clients informed about their condition and the reasons for isolation. Involve the family in the isolation process. Provide them with information on the purpose of isolation and encourage their active participation in supporting the emotional needs of the isolated client. To counteract the potential impact of isolation, incorporate sensory stimulation activities. This can include music, art, or therapeutic activities tailored to the individual preferences and needs of the isolated client. Isolation guidelines are fundamental in minimizing the transmission of infectious agents. Beyond the physical aspects, it's crucial to address the emotional well-being of isolated clients through effective communication and involvement of families. Tier 1, also known as standard precautions. These precautions encompass all body fluids, except sweat, non-intact skin, and mucous membranes. It's important to note that these precautions are applicable to all clients. Hand hygiene. Hand hygiene is paramount. Use an alcohol-based waterless product after client contact when hands aren't visibly soiled. Alcohol-based waterless antiseptic is preferred for its effectiveness in removing microorganisms. If spore contamination is suspected, use a non-antimicrobial soap. Visibly soiled hands require hand hygiene using non-antimicrobial or antimicrobial soap and water. Always remove gloves and perform hand hygiene between each client. Personal protective equipment, PPE. Masks, eye protection, and face shields are mandatory when there's a risk of splashing or spraying of body fluids. Clean gloves must be worn when touching anything that may contaminate the nurse's hands. Gown removal and disposal. Remove gloves and perform hand hygiene after removing the gown. Use a sturdy, moisture-resistant bag for soiled items, securely tying the bag at the top. Equipment and supplies. Properly clean all equipment for client care. Dispose of one-time use items according to facility policy. Contaminated laundry and sharps disposal. Bag and handle contaminated laundry to prevent leakage or contamination of clothing or skin. Enable safety devices on all equipment and supplies after use. Dispose of all sharps in a puncture-resistant container. Room assignment. A private room is not necessary unless the client is unable to maintain appropriate hygienic practices. Adherence to Tier 1 standard precautions is vital for the safety and well-being of both healthcare professionals and clients. By following these guidelines, we contribute to a safer healthcare environment. Transmission precautions. Transmission precautions are vital in preventing the spread of infectious diseases in healthcare settings. We'll explore Tier 2 precautions, starting with airborne precautions. Airborne precautions are crucial when dealing with infections caused by droplets smaller than 5 micrograms. Examples include measles, varicella, and pulmonary or laryngeal tuberculosis. To implement airborne precautions, we need several key components. 1. A private room for the infected individual. 2. Masks and respiratory protection devices for caregivers and visitors. 3. Use of an N95 or HEPA respirator if the client is known or suspected to have tuberculosis. 4. Negative pressure airflow exchange in the room, ranging from 6 to 12 exchanges per hour depending on the age of the structure. 5. Full face protection, eyes, nose, mouth. If splashing or spraying is a possibility, droplet precautions. Droplet precautions are designed to protect against larger droplets, generally exceeding 5 micrograms, which can travel 3 to 6 feet from the infected client. For droplet precautions, consider the following. 1. A private room or a room with other clients having the same infectious disease. 2. Masks for both providers and visitors. Contact precautions. Contact precautions are implemented to protect visitors and caregivers when they are within 3 feet of the client, guarding against direct client and environmental contact infections. Contact precautions needs the following components. 1. A private room or a room with other clients having the same infection. 2. Gloves and gowns for caregivers and visitors. 3. Proper disposal of infectious dressing material into a single, non-porous bag without touching the outside. Lastly, we have the concept of a protective environment. This is specifically designed to safeguard immunocompromised clients, such as those who have undergone allogeneic hematopoietic stem cell transplants. Key components of a protective environment include 1. A private room. 2. Positive airflow with 12 or more air exchanges per hour. 3. HEPA filtration for incoming air. 4. Mask for the client when out of the room. Understanding and implementing these transmission precautions are vital in maintaining a safe healthcare environment. It's crucial for healthcare providers to stay vigilant and adhere to these protocols to prevent the spread of infectious diseases. Transporting a client. If movement of the client to another area of the facility is unavoidable, the nurse takes precautions to ensure that the environment is not contaminated. For example, a surgical mask is placed on the client who has an airborne or droplet infection and a draining wound is well covered. Guidelines for cleaning contaminated equipment. 1. Always wear gloves and protective eyewear. 2. Rinse first in running cold water. Hot water coagulates proteins, making them adhere. 3. Wash the article in warm water with soap. 4. Use a brush or abrasive to clean corners or hard-to-reach areas. 5. Rinse well in warm water. 6. Dry the article. It is considered clean at this point. 7. Clean the equipment used in cleaning and the sink, still dirty unless a disinfectant is used. 8. If indicated, follow facility policy for recommended disinfection or sterilization. 9. Remove gloves and perform hand hygiene. Client education. Teach the client about any infection control measures at home. Self-administration of medication therapy and complications to report immediately. Thank you for listening to my audio notes on nursing. I hope you found them informative and helpful. If you did, please consider subscribing to my channel for more audio notes on a variety of nursing topics.